Good morning. So shortly after making this YouTube channel and thinking out loud, of course, the algorithm started to send me, videos of other people who have keywords that are similar to the keywords that I specified would be relevant to our discussion. And then the imposter syndrome and the street cred and social proof and all that business networking international elevator pitch. Why should you listen to me stuff kicked into my head? And I'm like, well, ultimately the market will decide. You'll decide, do I know what I'm talking about or not? That's kind of the point of this whole venture, is me actually trying to put what it is that I think that I know out there and see whether or not people think that I know what I'm talking about. So the question is, who am I? And I also add, who are you? So, who I am. 2004, I graduated from Alberta College of Art and Design with a degree in visual communication. So I'm an artist. I'm a creative. And you can see this is the kind of stuff that I made for the practice. I'm pointing to the little icons here. I'll put them up there for those are some videos. So that's the way my brain works. But the fact that I'm not a clinician is kind of the point. Even if you didn't have a holistic practice, I would argue that if you have your hands in people's mouths all day, then that begs the question, how are you nurturing relationships with the gatekeepers of the tribes that are critical to the type of referral that is essential for your practice? Anyways, artist. The office that I worked at, and I realized after making the first video I need to talk to my father-in-law, Dr. Tom Evans of Evans Dental Health and Wellness. When I started helping him with stuff out of school, his practice was called Rocky Mountain Dental in southern Alberta. And so right there, I think because he still carries a license, the implications of me just going totally unplugged are not entirely, isn't entirely up to me. So I have to talk to the old man, see how he feels about me going totally unplugged about our curious and ongoing relationship with our dental association, the Alberta Dental Association. But you have a dental association if you're a dentist, or a chiropractic association, or a naturopathic association. And anyways, so yeah, I got a BDes in visual communication, and I would gladly take the title brand manager, marketing manager. Ultimately, what I want to talk about is the suite of activities that I thought worked well. Ultimately, I can talk to the other practitioners. They can validate whether the ideas that I think are good were actually good, whether they were mutually beneficial, or whether the value relationship was as reciprocal as I think that it was or ought to be. But the currency between practitionerships, between offices, is high value referrals, the type of referrals who accept treatment, who pay out of pocket, whose home care and compliance is high because they value the treatment. They come dipped in trust, lots of trust handoff from practitioner to practitioner. And therein lies, I think, the critical point of all of this that I want to talk about. Who are you? I think you're either a dental student or a young associate, and you're seeing the value of securing highly sticky and long-lasting relationships related to that culture of holistic wellness. But it is a fine line, because if you, as you may already know, there are some terms that you might not want to get caught red-handed by your association competing for keywords on, like focal infection theory, or tooth meridian charts, or cavitation surgery, or natural root canal. You know what I'm talking about. The associations and the practitioners can roll their eyes about everybody Googling on their own, but guess what? People are Googling on their own. And so you learning how to find your people who are doing those searches is what this is about. Anyways, maybe that makes sense, maybe it doesn't. Maybe I've already scared you off. We'll find out in the next videos. Thanks.